Hi there, I'm Megan. I'm a student nurse from SPC.
Hi, I'm Lindsay.
Nice to meet you. Can I follow you around for a little bit?
Sure. This is Mr. Restivo, Mr. Levi Restivo. This is room 620. He's 67 years old. He comes to us today because he's had elevated blood glucose readings for the past 5 days. They've been about in the 300s. So he has allergies to tetracycline, dog hair, and peanuts. He's a full code. He has a good weight. His BMI is about 23.9. He went to Dr. Phillips' office today. That's his primary care physician, and his readings were in the 300s. So Dr. Phillips sent him here. He came to the ER and then was admitted through the ER. He has a primary diagnosis of stage 2 diabetic ulcer on the right heel and diabetes mellitus type 2. He's been insulin dependent for 20 years, ANO times 4. He has a surgical history of a transurethral resection of the prostate 5 years ago. Other than that, he hasn't had any surgeries. He was a smoker for 35 years. He quit last year. He drinks 1 beer per day. Neurological assessment revealed that he is Perla and good ocular motor movement. He wears glasses, and he's had been tingling in the bilateral lower extremities for the past 3 months. So we're going to examine that while he's here. Also, he's independent, so he can walk and everything by himself and go to the restroom, but we do ask that he call us when he needs to go because of the ulcer on his heel. He needs assistance. His lungs were clear and unlabored, and he has SCDs on while in bed to promote perfusion through his lower limbs and to prevent venous stasis. S1, S2 heart sounds heard, regular rate and rhythm, no murmurs, pulse is regular, 2 plus, less than 3 seconds capillary refill. His abdomen was flat, soft, and non-tender. Bowel sounds were heard in all 4 quadrants. He has regular bowel movements every day. He has had increasing appetite lately. He is on a 2-gram sodium, 1,800 calorie ADA diet while he's here. He says he's been very non-compliant while he's at home. He is voiding regular yellow straw-colored urine. His skin is dry and intact with good turgor, except for the ulcer on the right heel. He has a dry sterile dressing applied to that. He has a wound care consult coming later this evening, along with PT and an OT consult in the morning with a case manager that's going to come see him. He gets his vital signs taken every 8 hours. He's in medium fall risk. His brain is 18. His vitals have been relatively stable. He's been slightly febrile, 101.4 at 1550 and 100.1 at 1645. His heart rate was 76, 96% saturation on room air, and 132 over 70. He's been running slightly hypertensive in the 140s, so we're going to keep an eye on that as well. He has 3 medications scheduled for 5 o'clock. That's regular insulin we're going to give subcutaneously, vancomycin piggyback, and a lisinopril tablet. He also has some signaling that we need to start. That's going to be continuous drip. He's having his blood sugars checked 4 times a day before meals, and his last reading was 290 at 4:45. He has a IV in his right forearm, and it's a 20 gauge. And the doctor mainly prescribes some patient plans of diabetic teaching, glucose control, pain management, and some wound care. His most recent hemoglobin A1C was 13.4, which coincides with his serum glucose of 310 that he had a reading for earlier today. His white blood cell count was an 18.5, so it's slightly elevated. 3 months ago, his A1C was 8.2, so he's definitely been non-current the last couple months. Is there any other questions I can answer for you?
Yes. Why specifically is this client receiving this medication? What action does the medication have on the body?
So for the regular insulin, he's receiving that because he has diabetes mellitus type 2, and he's been insulin dependent for 20 years. So he's going to receive this 30 minutes before he eats. He should be having a meal tray come in about 30 minutes, so we want to get that to him now. The action on the body is it decreases blood glucose by binding to insulin receptors on skeletal muscle and fat, and inhibits hepatic glucose production. For his vancomycin, he's receiving that because he has a stage 2 pressure ulcer on his right heel. and his white cells are elevated and indicating some type of infection. This action, it hinders bacterial cell wall synthesis. It damages bacterial plasma membranes and makes the cell vulnerable to osmotic pressures. And it interferes with RNA synthesis. And then for the lisinopril, he has diabetes and he has slightly hypertensive, but he's hypodynamic tingling in the lower extremities, so we're going to administer that so it helps with vasodilation. And the action is it reduces the production of angiotensin 2. So when angiotensin 1 travels to the lungs, it changes to angiotensin 2. So this medicine is going to stop that. It suppresses the RAS system. And is there anything else?
Yeah, when should you question administering this medication?
Well,
Does the
sorry. Go ahead.
Does it have a therapeutic serum level?
Okay, so for the insulin, there's no real therapeutic level. We just want their blood glucose to stay between 70 and 110. So we want to monitor for signs for hypoglycemia. So if it's below 70, we definitely want to contact the doctor. For the vancomycin, we want to question it when they have hypersensitivities to corn, which is a strained one. If they have impaired renal or hepatic function, if they had hearing loss, if they're greater than 60 years old, because this medication's on the beer's list, so we have to keep an eye out for it. And also if they have allergies to other antibiotics. For lisinopril, we want to question giving that drug if they have hypersensitivities, if they have hyperkalemia, history of angioedema, which is the swelling of the face, lips, and tongue. It's a very serious reaction. Or if they have impaired renal function, hypotension, or if they have a chronic dry cough.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital and also for taking the medication safely at home?
For insulin, we want to teach Mr. Restivo that he needs to be taking this insulin 30 minutes prior to a meal or as soon as he eats. And then he needs to rotate his injection sites to prevent lipodystrophy. And also for the vancomycin, we want to teach him that he needs to take the entire amount of the drug to prevent having resistance to antibiotics. And also that he needs to report any discomfort at the IV site, as it can be dangerous to the surrounding tissues if it infiltrates. Also, if he's having any ringing in the ears, any hearing loss. Or if he starts to get a rash on his upper body, that could indicate red man syndrome. For his lisinopril, he wants to report any symptoms of angioedema, abdominal pain, breathing problems. Also, it can cause orthostatic hypotension, so he wants to make sure he gets up slowly when he's changing positions, and to rest if he feels dizzy. Also, that he shouldn't stop taking this abruptly, and that he shouldn't use salt substitutes as they are high in potassium and can cause problems.
You kind of went over this, but are there any additional side effects or potential adverse reactions? And how would you know the medication is effective?
For regular insulin, you want to monitor for signs of hypoglycemia, hypokalemia, weight gain, and possible anaphylaxis. You'll know that this medication is working because you'll have a stable blood glucose level. For vancomycin, you want to watch out for the normal antibiotic reactions like fever, headache, nausea, vomiting, diarrhea. Also, they want to look out for any hypokalemia, difficulty breathing, anaphylaxis, the red man syndrome that I mentioned earlier, and ototoxicity, which is tinnitus, and nephrotoxicity. You'll know that this is working when their white cells come down and there's no more signs of infection in their body. For lisinopril, it's usually a non-productive dry cough that can happen, and you can also become hypotensive. So you know this medication is working when they're at a stable blood pressure level.
All right, great. If you don't mind, I'd like to watch you administer your medication.
Sure. All right. Dr. Locke, Mr. Restivo. I'm Lindsay, the nurse today, and this is Megan. She's a little one nurse. She'll be with me. Okay?
Hi.
Okay.
First thing you want to do is wash your hands. It's very important that you maintain hand hygiene. All right, let's get ready. All right. Could you state your name for me, please?
Levi Restivo.
And your age?
6'7", 66.
All right, and do you have any allergies?
Tetracycline, dog hair, and peanuts. I don't like the peanuts.
All right. And let's make sure that the allergies in the chart match as well. So state those allergies one more time for me, please.
Peanuts, tetracycline, dog hair.
Perfect. All right, so now we want to check the medications that are ordered by the doctor. You see we have regular insulin ordered, vancomycin, lisinopril, and sodium chloride, and that's going to be continuous drip. All right, so first thing we want to do is we're going to need to check to make sure that his IV is still working properly. Let's get some gloves on. Let's see. Let's make sure these orders are in here. Alright, so I see vancomycin, lisinopril, and alright. Alright, so let's check this IV. I'm going to scrub for 15 seconds. Alright. You let me know if you feel any pain.
Feels good.
Alright. Doesn't look like it's red or it's swollen. Alright. Looks good. Okay. So now we want to give some sodium chloride. So we need to check his ID again. Can you restate your name for me, please?
Levi Restivo, 67 years old.
All right, let's enter your ID number. Mr. Restivo. All right, let's get our saline out. So when we look at the bag, we're going to check the expiration date, and it is in date. It's sodium chloride 0.9% normal saline. There's no sediment. It looks clear. It doesn't look abnormal. So basically, we're going to enter the med number. Alright, and I got a green light, so it looks good. So you're going to do the 5 rights, so make sure it's the right patient, the right medication, the right time, which is 5 o'clock, the right dose, which is 30 milliliters per hour, and the right route, which is IV. We don't have a pump today, so we're going to use a dial as well, just a little different way of doing things. So make sure it's clamped. Open this up, maintain sterility. We'll spike this back. Alright, and then we'll take the styrofoam out of the bag and we're going to connect it. And it's all sterile. It's fresh out of the bag. Make sure this is flowing. There we go. And it's good. Alright, so clamp that for a second. Alright, so we're going to need to scrub the hub for another 15 seconds since it's touched his clothing. Alright, I'm gonna hook that up. We're gonna unclamp this IV set. I'm gonna set this at 30 milliliters per hour. Alright, there we go. Clamp that up. Alright, so we place this in the right forearm. That's 1700. Alright, and I'll put my initials and I hit save. Alright, we'll move on to the vancomycin since that's an IV medication. Turn that on up. Get this out. Let's also get the tubing out as well. And compare it to the MAR. The ordered vancomycin, 15 milligrams. It's 250 milliliters in this bag, and it wants it over 2 hours, so we're going to run it at 125 milliliters per hour. So we need to verify our patient again. Can you state your name one more time for me, please?
We are Steve. I'm 16 years old.
All right, let's enter your patient number.
686.
There we go. Yeah. All right, and then let's enter the barcode number. And I got a green light, so it's good to go. All right, and this is an IV piggyback. So, right patient, right medication, right time, 1500, right dose, and right route. And that's going to be IV. So I open up my piggyback set. My primary line needs to be lower than my secondary. So I'm gonna bring it up like this. Spike my secondary line. Make sure it's clamped. Alright, so I prime that line. Let's hang it. Alright, so we're going to connect it to the highest hub. It's closest to the primary bag. We've got to clean that hub. 15 seconds. Hold there. You feel better?
Yes.
Oh god, it smells.
Better out than in. Alright, 15 seconds. We're going to hook this up. Get nice and clean. Maybe. Alright. Open that bad boy up. we're gonna set it at, it's gonna be set at 125 milliliters per hour. And it's dripping away. Cooking with gas. Alright. So give it at 1700. We're going to write here in the comments that it's 125 milliliters per hour. And that is 250 milliliters over 2 hours. Put our initials and save. Alright. So let's go ahead and give his next medication. Alright, Mr. Restivo, you have any trouble swallowing?
No.
Perfect. Alright, so you can take this pill by mouth? Perfect. Alright, can you state your name again for me, please?
Levi Vestido, I'm 67 years old.
Alright, let's enter your patient ID again. And do you know some side effects that you have to watch out for with lisinopril?
Yeah, if I get dizzy. And if I fall down old. And that's about it.
Okay.
Should I know other stuff?
So you're gonna have to look out if you start developing a dry cough that's non-productive. And if you do start to feel dizzy when you stand up, you need to make sure that you move slower and take your time because the medicine can make you kind of hypotensive. All right. So, so let's enter this medication. So we have lisinopril. It's a tablet. It's 10 milligrams, and we're gonna give it orally. And it needs to be given at 5. So, right patient, right medication, right dose, right route, and right time. So let's go ahead and enter this. I'm very serious. Alright, and I got the green light. Alright. Go ahead and take this for me. Alright. Down the hatch? Perfect. Alright, so let's mark that as 1700 is our administration time. Alright, and then put our initials. Okay, perfect. Alright, so now it's time for your insulin, Mr. Restivo. You're going to have your meal in about 30 minutes. So you remember what I said about you need to take this insulin 30 minutes prior to your meal? Okay.
I got a hot pocket coming up.
Right, and then we're doing a sliding scale, which your last glucose reading was 290. So the doctor says that if it's between, let's pull this up real quick. It says if it is between 241 to 300, you have to take 16 units, okay? So we're going to give you 16 units.
Okay.
All right, state your name again for me again.
DRC.
And your age.
67 years young.
All right. There you are. So let's get your insulin out. Okay, 2 of these. And a needle. All right. So we have the insulin. Check the expiration date. It is in date. And we're going to give this subcutaneously. It's regular insulin. Alright, so let's enter this. And we're giving this at 5 because we'll be eating in 30 minutes. Green light. Good to go. Alright, so this is a multi-use vial, so we have to clean the top. Alright, and then this is the insulin needle. We're going to look on this side for the units, and we're going to pull back 16 units of air because that's how much is ordered for him. Put this straight down. Push in some air. And then I usually draw back a little bit more than 16 and then just push it in. It's a little bit easier and that way you don't get as many bubbles. Hey Megan, can you verify that I have the right dose? I need 16.
Oh yeah, it's perfect.
Thank you very much. All right. And where was your last injection at?
In my right upper quadrant.
All right, so we're going to do your left upper.
Here, I'm just gonna hand you my belly
All right.
so I don't get stuck.
Okay. We're doing left upper quadrant. We're going to clean. And then since he's not too skinny, we're going to do a 90-degree angle. Push down in there. We're going to leave it for 5 seconds. If he was very skinny, then we would have to pinch it and insert it at a 45-degree angle. And that one doesn't want to reach out. So we're going to put it immediately into the sharps container. Thank you very much, Mr. Steve-O. So we're going to put 1700, excuse me. And then that is in 16 units in the left upper quadrant. My initials. And we're going to click save. And we're given all of his 1500 medications. So let me clean up my mess real quick. All right, Mr. Recibo, can you tell me some of the side effects you can get from vancomycin?
No.
No, okay, so that would be something a rash on your upper body. That could be Raynaud's syndrome. Also, if you get any ringing in your ears, that can be a bad sign, so you have to let us know, okay? Also, if you start to feel nauseous, like you're going to vomit or have diarrhea, any of those things, you can let me know, okay? And here's some more information about it. This medication I usually take it home. So, and since it's a new antibiotic for you, I wanted you to know more about it. I'm going to lower your bed back down. Perfect. And here's your call light. And if you need anything, you let me know, okay? Can you tell me one more thing about the insulin that we talked about earlier?
You said to make sure to rotate my sights, and you said to check my blood glucose, and you said to make sure that I know when my meal times are, so I take it for my meal times.
Perfect. That's what I like to hear. Okay, you give me a call if you need anything, okay? I'll be right out here documenting.
All right.
All right, Megan, come right this way. All right. It's very important that you do this. All right, and did you have any questions for me?
Yeah, I did actually. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, so it was very important that I made sure that when I was giving his insulin that I knew his latest blood glucose level. I knew that his blood pressure was in range to receive his lisinopril, and also that the vancomycin, he had any prior sensitivity or reactions to that type of medication. Any other?
Yeah, did this information affect your decision? And did this information affect how you administered the medication at all?
Definitely, especially with the insulin, it's a sliding scale, so I needed to know the exact reading so that I could give him the accurate measurement, accurate unit amount. And for the vancomycin, the next time he gets an injection, I'm going to need to check his peak and check his trough 30 minutes before he gets his next dose.
All right, no, that's it. Thank you so much for letting me follow you around.
Sure, come on over and watch me document.
All right, great.